When I was getting ready to get my heart cath done and I found that I was pregnant, it was a big shock.
I think I found out Renata was pregnant the same day that she did. She had presented in the morning for a heart cath and had a positive pregnancy test in pre-op. During a normal pregnancy, your cardiac output almost doubles. So a patient coming into pregnancy with heart failure may not be able to keep up with the demands required of the pregnancy.
We were all very worried, not necessarily because of the procedure. The procedure was actually canceled, but how do we tell her and what do we do now?
I actually came in for a doctor's appointment with Dr. Navarni, and she said, well, you know, we had already talked about that you may have to come in and stay for the duration of your pregnancy. I said, well, you know, I would much rather be here and be safe than go to Waynesboro and then having to get the ambulance or something to get me back here and something happens.
So that took a village. It was a lot of effort and coordination. Daily visits, make sure that we were looking at labs, looking at echocardiograms, daily physical examination to make sure the fluid level was maintained, adequate for both the baby and the mom.
We had a very well-planned, scheduled delivery the day that it happened with an amazing multidisciplinary team with OBGYN, maternal-fetal medicine, cardiology, cardiac anesthesia, and the delivery itself was uneventful.
After they got me all set up and took me back, and wasn't long after I had him, and he came out, and he was just like this. He came out with his hands up like he was saying, "Thank you, Lord."
The very next day, I remember I went to see her, check on her. We started talking, she was showing me some pictures of the baby, and you can tell as she was talking to me, she's starting to decompensate immediately.
Cardiogenic shock is when the heart can no longer keep up with the amount of blood that it needs to pump.
So we decided to urgently get her a mechanical long-term circulatory support device. We call that the LVAD, for left ventricular assist device, and that's how we were able to successfully implant it and get her out of trouble.
Living with the LVAD is, I didn't think I could do it at first, but once I got to learn how to do it, it's just like part of my routine now.
Renata likes to use a very beautiful purse and keeps the battery with her, so you don't really tell that the patient's having or is supported by a mechanical pump that way. So she's able to have a normal life, or as close to a normal life, care for the baby, care for her day-to-day activities.
He's just a joy to have. We got to do skin to skin when they brought him into the CCU, and it's the hum of my LVAD that he goes to sleep off of. And he's 1 year old now, and he still lay on my left side, and he listens to my LVAD at night.
So patients that undergo an LVAD procedure, they typically have a very rapid improvement in the quality of life.
My experience with Dr. Navarni and Dr. Hernandez, they were godsend. It was just amazing. We became a family, and I just love them to death. Like, I've known them all my life.